In the early 20th century, doctors believed they had found a miracle cure for mental illness. Not a pill, not therapy, not understanding. A blade. Mental hospitals were overcrowded. Depression, schizophrenia, anxiety, trauma. There were no effective treatments, and patients were often locked away for life. Families were desperate. Doctors were under pressure. Society wanted solutions. And then someone had an idea. What if the problem wasn't the mind, but the wiring? The idea began in the 1930s. A Portuguese neurologist believed that mental illness was caused by faulty connections in the brain. His theory was simple. If those connections were cut, the illness might disappear. The procedure was called a lobotomy. It involved severing parts of the brain's frontal lobes, areas responsible for personality, judgment, emotions, and decision-making. Early reports claimed success. Patients became calmer, more manageable, less emotional. Doctors celebrated. What they didn't say was what had been lost. The lobotomy spread quickly. In the United States, it found its most enthusiastic champion in a man who believed speed mattered more than precision. He believed lobotomy should be fast, cheap, scalable. He believed they should be done everywhere, and he found the perfect tool. It looked like an ice pick. The instrument was inserted through the eye socket. A small tap with a hammer drove it through the thin bone behind the eye. The tool was then swept side to side, cutting brain tissue. The entire procedure took less than 10 minutes. No operating room required, no surgeon needed, sometimes no anesthesia. Patients could walk out afterward. Changed. This became known as the transorbital lobotomy, and it exploded in popularity. By the 1940s and 1950s, tens of thousands of lobotomies were being performed across the United States and Europe. Some patients were severely ill, others were not. Women were lobotomized for depression, teenagers for rebellious behavior, children for learning difficulties, housewives for being too emotional. Consent was often ignored. Families were told it was the only option. Some patients became quiet, but quiet didn't mean healed. Many lost their personalities entirely. They became passive, childlike, unable to plan, feel deeply, or live independently. Some lost the ability to speak. Some lost bladder control. Some died. Others lived, trapped in bodies that functioned, but minds that had been erased. Doctors called it progress. Hospitals called it efficiency. Families called it hope. But patients paid the price. The lobotomy reached its peak in the 1950s. Then something changed. New psychiatric medications emerged. Antipsychotics, antidepressants, treatments that didn't require destroying the brain. Criticism grew louder. Journalists exposed the outcomes. Former patients spoke, those who could. Medical professionals began to question the ethics. What had once been praised as revolutionary was now impossible to defend. By the 1960s, lobotomies began to disappear, quietly. No public apology, no mass acknowledgement, no reckoning. Just a procedure that faded away, leaving tens of thousands of altered lives behind. The lobotomy craze wasn't born from cruelty. It was born from desperation, from fear of mental illness, from overcrowded institutions, from a belief that doing something, anything, was better than doing nothing. But history shows us something else. When speed replaces care, when control replaces compassion, and when silence is mistaken for healing, the result isn't treatment, it's damage. The lobotomy didn't cure mental illness. It removed the parts of people that made them difficult to understand. And once those parts were gone, they couldn't be put back. This wasn't ancient history. It happened within living memory. And it reminds us that progress, without humility, can be as dangerous as ignorance. This is WTF History.